Our group covered subacute rehabilitation and consisted of Leah Boyle, Laura Marley, Ricky Morris, Ashley Schmitzy, and Roxy Voss. The clinic is named Rise Above Rehab. Subacute rehabilitation clinics provide treatment to patients after discharge from the acute care setting when ongoing care is required to recover from an acute injury, illness, or exacerbation. Treatment in a subacute rehabilitation facility is generally less intensive than that in an acute care setting, and patients receive coordinated care from numerous healthcare professionals. Subacute rehabilitation settings serve as a bridge to regain function to return a patient home or onto another level of healthcare, such as a nursing home. The organizational structure. Rise Above Rehab's slogan is Rising Above Life's Limits. Rise Above Rehab is a subacute rehabilitation facility located in the rural town of Washington, Missouri, but is affiliated with Mercy Hospital in St. Louis, Missouri. Rise Above Rehab has the capacity to care for a total of 40 patients at any given time. The majority of patients treated at the facility are discharged from acute care at Mercy Hospital and admitted to Rise Above Rehab for further rehabilitation. However, Rise Above Rehab admits patients from surrounding hospitals, such as Herman Area District Hospital and Lincoln County Medical Center, if those facilities are unable to provide adequate treatment. Admission of patients from surrounding hospitals is dependent on the availability of a bed at the time. Patient rooms are single occupancy to ensure a comfortable stay during time at the subacute rehab facility. Patients are typically admitted for 3 to 4 weeks at a time. However, the actual length of stay of each patient varies depending on multiple factors, including the severity of the condition, comorbidities, and functional recovery. Our mission statement: to provide optimal care in order to facilitate our patients' maximal potential. We commit to providing the most beneficial, hands-on, and evidence-based care in order to fully maximize each patient's quality of life. We strive to serve beyond the patient's expectations by treating the person as a whole, mind, body, and spirit. Our vision statement: shaping the future of rehabilitation to provide the highest caliber of care by optimizing function in the community and beyond. Rise Above Rehab will distinguish itself through its knowledge, expertise, communication, and compassion for providing superior transitional care to patients and their families. The Subacute Rehab Clinic is accredited by the Commission on Accreditation of Rehabilitation. In order to serve Medicare and Medicaid patients, the clinic is certified by the Centers for Medicare and Medicaid Services. The Physical Therapy Clinic operates from 8 a.m. to 5:30 p.m. on Monday through Saturday and holidays. No physical therapy services are provided on Sundays. The Saturday and holiday schedule differ from the normal weekday schedule, with separate hours and fewer staff members present to provide treatment. At this subacute rehab facility, the physical therapists treat patients with all conditions, but the facility specializes in neurologic disorders such as spinal cord injury, stroke, and traumatic brain injury. The physical therapy department at Rise Above Rehab is managed by the senior physical therapist. The senior physical therapist interacts and communicates with the other healthcare departments in the facility to ensure patients receive the highest quality care that encompasses all aspects of the body and enforces the policies and procedures enacted by the facility. The physical therapy gym consists of 8 high-low tables in an open area and 2 private rooms with high-low tables. The gym is equipped with all necessary equipment to treat patients, including bariatric equipment. However, due to lack of space, Rise Above Rehab does not offer aquatic therapy.
Labor statistics. Physical therapy staffing at Rise Above Rehab consists of 6 full-time physical therapists, 2 full-time physical therapy assistants, 3 hourly rehab technicians, and 3 weekend or as-needed physical therapists. Rehab technician duties include putting away and cleaning equipment, changing bedding, laundry, taking inventory, and calling the orthotist or prosthetist as needed. Due to subacute rehabilitation requirements, each patient has physical therapy for a minimum of 90 minutes each day for 5 days per week. If the patient requires speech-language pathology, physical therapy is only required for 75 minutes each day. At maximum bed occupancy, each physical therapist or physical therapy assistant is required to see 5 patients a day. The table to the left is a tentative schedule assisting the therapist in their time management. This table assumes that none of the patients have speech therapy. Evaluations are completed on the patient's first session of therapy and are scheduled for 60 minutes with the remaining 30 minutes for treatment. Scheduling is made through the receptionist. If a patient is admitted and evaluated on Thursday or Friday, one of the 3 weekend therapists is required to see the patient for treatment on Saturday. Evaluations may also be conducted on Saturdays by one of the physical therapists. If a weekday physical therapist has to work a Saturday and the therapist is paid time and a half for that day. Therapists are assigned to certain holidays each year, which will also be paid as time and a half. As stated previously, there will be no therapy on Sundays.
Marketing and market share. Due to Rise Above Rehab's affiliation with Mercy Hospital, there will be a decreased need to advertise to Mercy Hospital. Also, since the majority of patients will be coming from Mercy Hospital, there will be a decreased need to advertise in the area. That being said, Rise Above Rehab will advertise to local hospitals that they are not affiliated with by holding luncheons once a month, where they will describe what they do at their clinic, how current therapy is progressing, and answer any questions that the hospitals may have. Rise Above Rehab will also send flyers to other local healthcare facilities, telling them about our services and offering to come do a luncheon if the facility would like to know more information. There will also be advertisements to the local community in ways of billboards near the highway by the clinic, TV and radio commercials, just telling a short, brief statement about what Rise Above Rehab does and the facility. They will also have a Facebook page to inform the public about Rise Above Rehab and provide any tips and for future and past patients. Market share. Subacute care makes up a small percentage of all physical therapy, roughly about 4%. That being said, Rise Above Rehab will make up a very large percentage of subacute in the area, nearly 100%, since the next closest rehab facility is over 40 miles away. As you can see from the chart, physical therapy is mostly dominated by inpatient care and outpatient care, as to where subacute is the red sliver that is about 4% of all care.
Delivery of care. Rise Above Rehab follows the strict requirements for subacute rehab settings regarding delivery of care. As stated previously, each patient is seen for a total of 3 hours a day. If the patient does not require speech-language pathology, this patient's schedule is as follows: 90 minutes of physical therapy and 90 minutes of occupational therapy. If the patient requires speech-language pathology, the patient's schedule is as follows: 75 minutes of physical therapy, 75 minutes of occupational therapy, and 30 minutes of speech-language pathology. A pre-admission screening process is performed on all patients before 48 hours of admission. If this is done earlier, the screening must be updated. Post-admission evaluations are documented within 24 hours of discharge and compared to the pre-admission screening. Rise Above Rehab strives to provide a loving, comfortable, and most importantly, safe environment for all patients during their stay. To best abide to the stringent schedule and for safety reasons, a therapist will receive the patient from his or her room and accompany the patient to the therapy gym. Treatment sessions may also involve performing ADLs in the patient's hospital room. Chair and bed alarms are activated in each room in order to enhance the patient's safety. Each patient is provided a gait belt as well, which is used at all times for locomotion and transfers. This subacute rehabilitation facility possesses multiple different assistive devices for patient use based on the physical therapist assessment. Phone interpreters are available at this facility for patients that do not speak English. Interdisciplinary team meetings will be held on each Tuesday and Thursday of the week during the lunch hour to discuss each patient. The interdisciplinary team consists of the following: physician, nurse, physical therapist, occupational therapist, speech-language pathologist, dietitian, and case manager. Physical therapy assistants cannot, for any reason, be a part of the team meetings, and upon discharge, a patient receives a patient satisfaction assessment. This gives the patient an opportunity to comment on their visit and what met their standards, as well as what needs change. A human resources manager of the facility is available for employees to express their concerns, issues, suggestions, and praise to ensure delivery of quality of care and workplace satisfaction.
That's quick.
How long is it so far?
10:46.
Starting will probably be like 15 minutes. Nice and slow, Laura.
Policies and procedures. Rise Above Rehab will implement the following policies and procedures to help ensure the safety of both patients and employees. Informed consent will be obtained from each patient on initial admittance into the rehabilitation floor and prior to his or her participation in therapy. This informed consent will briefly describe the requirements of therapy participation and will state the potential side effects that may occur after therapy, such as muscle soreness, bruising, falling, fatigue, etc. If a therapist plans on conducting a specific treatment, before starting, the therapist must explain to the patient the benefits and risks of each treatment. In this way, the patient can be knowledgeable of what is happening during the session and why. Patients will not be allowed to record therapy sessions. If a patient refuses treatment 3 times, discharge plans will be discussed with the interdisciplinary team. Each patient will be given a written copy in full explaining the aforementioned material. The dress code will require all physical therapists, physical therapy assistants, and rehabilitation techs employed by Rise Above Rehab to wear black scrubs and a name badge at all times. Other healthcare professionals will be assigned varying colors of scrubs to help differentiate between professions. Closed-toed shoes and socks or hose are to be worn at all times and are required in clinic areas. Good personal hygiene is expected of all employees. Hair must be clean and worn in a manner that will not interfere with patient care. Male employees must maintain groomed facial hair, including beard, mustache, sideburns, etc., and must be no longer than 2 inches. Fingernails are to be trimmed to a reasonable length. Nail polish may be worn, but it must be neutral in color and free of chipping. Therapists are prohibited from artificial nails, such as tips, wraps, acrylics, gels, etc., in the facility. Jewelry may be worn if simple and does not interfere with patient care, and piercings are only allowed in the ear and prohibited anywhere else visible on the body, including the tongue. Rise Above Rehab requires all of its employees to participate in a yearly physical examination and maintain up-to-date vaccines. These vaccines include, but are not limited to, measles, mumps, rubella, chickenpox, hepatitis B, meningitis, Tdap, and a yearly flu shot. Employees will also maintain a clean and safe work environment for patients. Every healthcare professional is required to wash hands between each patient and wipe down any equipment used during that session. All healthcare professionals must remain CPR and first aid certified while under the employment of Rise Above Rehab. Employees may participate in recertification courses provided in-house or at another approved facility. Rise Above Rehab provides 8 computers within the Subacute Rehabilitation Clinic for documentation purposes. Documentation must be completed in the clinic and before the end of the day for correct billing purposes. Every therapist must follow the guidelines set by the Health Insurance Portability and Accountability Act, otherwise known as HIPAA. This includes signing a confidentiality agreement before beginning employment at Rise Above Rehab. Each computer can only be opened with a Rise Above Rehab user identification name and number and an individualized password. No employee will share his or her user ID and password with anyone for any reason. If an employee believes his or her password has been compromised, he or she will change it immediately and notify a Rise Above Rehab supervisor. Employees must log out of WebPT after completing their session. A session is automatically logged out after 10 minutes of inactivity. Computers have tinted screen protectors to help protect patient confidentiality. Employees may not discuss confidential information with unauthorized parties, including family, friends, and other coworkers. Personal electronic use while in the clinic is prohibited unless being implemented for an assessment tool. A violation of any of these terms may be subject to termination of employment and may be subject to criminal or civil prosecution. Rise Above Rehab will conduct annual competency assessments of each employee and the clinic as a whole. This annual competency assessment will examine each therapist's productivity, patient reviews, peer reviews, and supervisor reviews. This assessment will also help determine potential raises for each employee. A yearly human resources meeting will be conducted after all employee competency assessments have been completed to review the clinic's policies and procedures. For example, Rise Above Rehab implements certain codes for specific situations that can occur in the hospital. Employees must be able to recognize these specific codes and choose the appropriate response for each one. Examples of these codes include Code Red, meaning fire, Code Blue, meaning unresponsive patient, Code Adam, meaning missing child, etc. Rise Above Rehab will also offer monthly in-service opportunities for all of its employees.
Outcome measures, documentation, and communication. The physical therapy department utilizes the functional independence measure as a unified form of assessing a patient's functional status. Each patient's FIM score is evaluated on admission and again assessed at discharge. In order to deliver the best quality care, patients complete a patient satisfaction survey every 2 weeks and again at discharge. Therapists are encouraged to perform additional outcome measures relating to the patient's specific condition to assess their status and determine the effectiveness of treatment. At this subacute rehab clinic, all documentation and patient communication is recorded through the online program WebPT. Through this program, therapists log patient interactions and treatments as well as manage appointment times through the calendar. Therapists are encouraged to document patient interactions in a timely manner to ensure an accurate and thorough recounting of the treatment. Therapists are educated on the latest updates to the program. A bulletin board hangs in the physical therapy office and notices and announcements are posted to inform therapists of important information. Physical therapists and physical therapy assistants must meet at least every 30 days to review patients under the care of the PTA in accordance with the Centers for Medicare and Medicaid Services. Interdisciplinary teams meet weekly to discuss each patient's status.
Risk management. This subacute facility enforces risk management policies to reduce the potential of future liability and to create an environment with the least amount of risk to patients. The facility provides workers' compensation in the event of a work-related injury to an employee, as well as liability insurance for each therapist. Therapists attend regular in-services and additional education courses to ensure they remain knowledgeable on the risks and benefits of available treatments. Therapists must complete a yearly review course on infection control, OSHA safety standards, transfers, signs of abuse, and emergency procedures. Therapists are required to file an incident report and document any unusual event occurring during the treatment, including all suspected abuse. All accidents, incidents, and falls are reviewed to determine the need for implementation of new policies to promote safety. Therapists and patients adhere to infection control policies to decrease the spread of infections, and the facility is constantly assessing ways to eliminate hospital-acquired infections. During the hiring process, potential employees undergo a background check, drug screening, and verification of Missouri therapy license to determine their eligibility to practice at Rise Above Rehab. Patients are asked for their name and date of birth prior to sessions to ensure correct identification before treatment. Patients are informed of the risks, benefits, and alternative options to treatments, and patients are encouraged to ask questions about the proposed treatment. HIPAA policies are strictly enforced to ensure patient confidentiality. This subacute clinic enforces safeguards to limit who has access to patient information and trains employees on how to protect this information. Patient information is disclosed to other healthcare professionals within the regulations of HIPAA and Missouri law. The staff is encouraged to maintain a clean clinic free of obstacles that could serve as fall hazards. Yearly inspections are performed on each piece of equipment to ensure that it is safe to use during treatments. Temperature for the hot packs and paraffin are constantly monitored to ensure that it is appropriate, and patients are closely monitored when these modalities are being used. Therapists are trained on the appropriate use of the equipment to prevent the risk of injuries. The parking lot is well lit and free of uneven surfaces to ensure the safest environment. The design of the Subacute Rehabilitation Clinic's building is in accordance with the American Disability Act policies. And that concludes our business plan of a subacute rehabilitation facility, Rise Above Rehab.